virtually all 23 people who have passed in the city of Houston have had underlying health conditions. A Hispanic female in her 90s with underlying medical health conditions who passed away on April the 6th. A white female in her 90s with underlying health conditions who passed away on April the 5th. A black male in his 70s with underlying health conditions, he passed away on April the 9th. A white male in his 80s with underlying health conditions who passed away on March 28th, and a black male in his 50s with underlying health conditions who passed away on April the 6th. And so as the information is presented to us based on the documents that we have, the medical records, then we are updating this information. So again, 40 new cases, 5 deaths, which brings the Houston total count to 23. Today, the city of Houston drive-through testing site started testing anyone whether they were symptomatic or asymptomatic. We have doubled the daily testing count to 1,000, and the tests are free to the public. And people can call the department COVID call center at 832-393-4220 between 9 and 7 p.m. to receive a unique identification code and then proceed to the testing site. As of 1 p.m. Today, we had given out more than 800 unique ID codes for COVID-19 testing, and we plan to cut it off for the day when we reach the 1,000 mark, and quite frankly, we could be at that point right now. It does indicate with the amount of interest, there are a lot of people in the Houston area that want to be tested, whether they're symptomatic or asymptomatic. So many people called in earlier today, it overwhelmed the system, and we end up adding additional operators. We started off today with 18 operators, and we quickly increased that number to 25, and we plan on adding 50 operators, have 50 operators available tomorrow for the anticipated demand. And if you did not get in today, please call tomorrow. But bear in mind, these tests will occur every day. So please be patient. There are many people in the city who want to be tested, and the plan is to accommodate each and every one of you as we work every day to increase the capacity of our testing. Dr. First.
Thank you, Mayor. And yes, the response from the public has been remarkable. We had anticipated an increased call volume, so we had already added 10 call takers prior to today. And in spite of that, the number of calls that came in was overwhelmed the system for a while. Tomorrow, we will be adding at least another 15, drawing on our partners. And I want to thank libraries, Parks and Rec, and our colleagues at 311 for helping us ramp that up so quickly. So we will have more call takers available tomorrow and try to mitigate this. But at the end of the day, the issue is there are so many people who want to be tested, and even by going to 1,000 a day, we ask that the public be patient with us. We will continue, moving forward with this. And I also want to thank our colleagues from the Houston Police Department who have been very instrumental in managing the traffic, which was remarkable today, and they did a great job with that. So I wanted to just make those comments about the call centers. Additional cases today, and you mentioned that yesterday versus today the numbers are smaller, and we continue to have this inconsistency in the number of cases that are being reported to us. And I touched immediately. That is the term that is used, immediately. And so when we get these peaks and valleys, when we get these peaks and we get as many as over 600 reports in the day that going back 6 weeks, that is not helpful. That's why the law says that you are to report that immediately. We understand that it's going to be a day before we get it, and we have to process it so we can all do better with that. In addition, the other count that we pay attention to is the number of deaths. And like we posted on our webpage today, not only the age, relative age, the gender, but also the date of death. And you'll notice that with today's 4 of the 5 deaths occurred within the last 10 days. The law requires that physicians report the death. They have 10 days to report the death to the local health department. We have asked by phone calls and calling around the city and working with our partners in the health department, in the medical community, that we've asked them to be more prompt than that. We would like to know within 24 to 48 hours again, so that we can make more informed decisions. And you'll notice in one of these, the person who died back in March. So this is now at least the second time when we have had a greatly delayed report of death. And we found this one through our efforts of going through death certificates. And there are many death certificates. This is a big city. There's a lot of people, the death certificates occur per day. That's natural. But we've gone through those, we've culled through those and found, and that was the second time we found a case of someone who died related to COVID disease, which had not been reported to us. Again, that is not helpful. So again, to our physicians and hospitals and other healthcare providers, please recognize the vital importance it is to our elected leaders to be able to make informed decisions based on the information that you will be providing us. And so that needs to be done timely. And we're working together on this. This is a difficult situation. We've never asked this of you before. We recognize that, but clearly you can understand the reason why we're asking this. And so please pay attention. Do what you can to get this information to us as quickly as possible so that we can make more informed, clear-minded, strategic decisions.
We'll come through all of those records ourselves. At whatever point in time, all the information will be made readily available in that regard. So today, 23 days, and then we're adding 40 new cases to our account. Let me also, at this point, let me also acknowledge Mayor Pro Tem Dave Martin and City Councilman Edward Pollock, who's also here with us as well. Chief King.
Yes, sir. Thank you, Mayor. Good afternoon. My report's going to be short today. Your Houston Fire Department remains fully operational at this point. Our call volume has remained flat as well. I'm happy to report that the number of personnel in quarantine at this time has dropped. We're at 87 today. We still have one firefighter, Captain Capistrano, who's still in the hospital. He's making good progress, and we hope to see him released from the hospital this week. We've tested 87 firefighters through the course of this operation for COVID-19. We've received 58 of those tests back, still waiting on 29. Of those, 28 have tested positive through the course of this operation. 14 of those, 50%, have since recovered and are back to work, and 14 are currently recovering. In regards to our occupation task force, we had 133.
Good afternoon, Mayor. Thank you. Let me bring this up. Here's our report in terms of our personnel. First, I want to start off first and foremost by letting everyone know we absolutely appreciate the continued prayers for Raymond Cervantes and his wife Liz. She is doing well. As you all know, she was positive for COVID, but she's handling it well. He continues in ICU. He's still on a ventilator, but his lung the functioning of his lung continues to show some improvement. So we remain hopeful, and we just continue to ask for prayers for him and his family, and we truly appreciate it. As of today, we have 101 members of the Houston Police Department in quarantine, 73 classified sworn off personnel, and 28 civilians. We have had 162 members of the Houston Police Department tested for the virus. 156 officers, 35 have come back positive, and 84 have come back negative, with 37 pending. And we've had 6 civilians that have been tested, Mayor. 1 has come back positive, 1 negative, and 4 pending. We're up to 10 individuals that have returned to work, up from 7 from my last report, up to 10. And as it relates to the department, we're at 100% capacity. All of our divisions are fully staffed, and our call volumes now appear to be coming back to historical norms instead of being down, with violent crime in terms of murder, which is starting to trend upward, which is a little bit of a great concern to us, and the assaults and domestic violence that was a great concern to us. And so again, we urge folks to, especially when it comes to violence in the home, if you see any children that you see outside their home and you start seeing any changes in their behavior, please, if you see any bruising on them, and please let us know so we can take a look and make sure that these children and these families are safe. And to the families, just remember our partners at the Houston Area Women's Center and other partners are fully functional and available to you and to us, and there are other shelters we can get you to. If you're in a dangerous situation, please call 911 let us know. We will be there and we'll help you out. That's my report today.
And for your transparency and sharing these numbers with us daily to keep the public updated. And also, thank you for opening up the testing centers to everybody. I know there's a lot of people out there that really wonder whether they have the COVID-19 or not. This is just one way to get the mask. As a matter of fact, all city employees that are out there working have masks. So we're still looking at donations. So anybody that can donate, you can email us to donations@houstonoem.org, donations@houstonoem.org, and we'll make arrangements to pick up the supplies or arrange delivery. The quickest way to get the PPE out to the first responders and other essential city employees is through donations. So we appreciate that. I know the mayor's going to be talking about a donation right after this. We appreciate that generous donation. Thank you, Mayor.
50,000 vinyl gloves to the city of Houston for our healthcare workers and first responders, and I want to thank him and his employees for their generosity.
Thank you. My name is Ntuba. I'm a franchisee of Jack and Box, and I want to thank Mayor Turner and the leadership for inviting us and extending this